Can environmental factors affect early glaucoma detection? Have you ever wondered if the environment around you could influence your eye health? Specifically, can it affect how early glaucoma is detected? The answer is yes. Environmental factors can play a significant role in the risk, progression, and clinical presentation of glaucoma, which ultimately impacts how and when this eye disease is identified. Glaucoma is a serious eye condition that damages the optic nerve and can lead to vision loss. While genetics are a key factor in determining who is at risk for glaucoma, environmental influences are also crucial. These factors can affect the biological processes that lead to glaucoma and can change how early the disease is detected. One major environmental factor is geographical and climatic conditions. For instance, living in northern latitudes has been linked to a higher risk of certain types of glaucoma, like exfoliation syndrome. This may be due to environmental triggers such as temperature and sunlight exposure, which can influence how our bodies process vitamin D and other important functions related to eye health. Another important factor is air pollution. Research shows that long-term exposure to fine particulate matter in the air can increase the risk of primary open-angle glaucoma. These pollutants can cause oxidative stress and inflammation in the cells of the retina, leading to damage of the optic nerve. This environmental exposure can speed up the progression of glaucoma, potentially affecting how early the disease can be detected. Lifestyle choices also play a role. Factors such as smoking, alcohol consumption, diet, physical activity, and stress levels can all influence the risk of developing glaucoma. These lifestyle elements can affect intraocular pressure and the health of the optic nerve, complicating the signs that doctors look for during early diagnosis. Socioeconomic status and occupational exposures can further impact early detection of glaucoma. People with limited access to health care or those exposed to certain workplace hazards may not receive timely screenings, which can delay diagnosis. The relationship between genetics and environmental factors means that these influences can change how glaucoma presents itself. For example, environmental triggers may cause the disease to develop more quickly or may make early signs harder to notice, depending on individual circumstances. From a clinical perspective, understanding these environmental influences is essential for improving early detection strategies for glaucoma. By recognizing the risk factors associated with the environment, healthcare providers can better target screening efforts for those at higher risk. Additionally, reducing exposure to environmental risks, like air pollution, and promoting healthier lifestyle choices can help slow the progression of glaucoma and protect vision. In summary, environmental factors do indeed affect early glaucoma detection by influencing the risk and progression of the disease. By integrating assessments of these environmental risks with genetic evaluations, we can enhance the early identification and management of glaucoma, ultimately leading to better outcomes for patients. Always remember to consult with healthcare professionals for personalized advice regarding your eye health.